Hello, this is Dr. Tony Nalda. I'm here to talk to you regarding some set procedures, mostly our neuromuscular retraining or our anterior head weights. Now, there are three types of care. The first type of care is going to be an active care. Active care is where the patient is constantly participating in the activity to create an isometric or a muscle strength or a muscle recruitment. This is going to be mostly the isometrics that we prescribe. Reactive care is where a patient is unconsciously participating in the activity of movement. What that means is that there's a neurological response. It's an automatic response to the activity or the load that you're placing upon the patient. Reactive care does a stronger recruitment neurologically and a stronger recruitment to the muscles and tissues that actually support and hold the spine, as opposed to active care. Passive care is where the patient is not really participating in the movement. It's more like just the patient is allowing something to do the exercise or the movement for them. This tends to be adjustments, passive molding. Those types of things tend to have a great amount of passive care. Now, with reactive care, we really only have one version. That's going to be body weighting. Body weighting is going to be the most effective form of us doing reactive care. What makes our care so powerful is that we're going to have active, reactive, and passive care. They're all needed. I'm not saying one is better than other. Active care is strong for recruiting very specific muscles that you want to work. Reactive care is for general spinal change and stability of the little muscles that support the spine. Passive care has a great effect on helping mobilizing the spine. So they're all very, very, very effective. One thing I want to note is that I believe spinal adjustments actually affect all three phases of care. I think there's some active, I think there's some reactive, and I think there's some passive. I think that's why spinal adjustments are as powerful as they are. Now, one thing to understand is that we're trying to focus on a reactive correction model. We're not trying to force the spine back into a correct position. So really nothing has more to do with the spinal correction than getting the actual right adjustments and the right spinal weighting. I think these two things in combination can provide a great correction, even if we had no passive care or no isometrics. Remember, we don't force correction, we facilitate correction with spinal adjustments or rehabilitation. We're not trying to force the spine into a position that it's not meant to go into. We're just trying to facilitate the correction by removing neurological interference and supporting the healing process once that removal of that interference is done. So anterior head weights have three primary indications. So you can see here in this first x-ray, forward head posture by far is a number one indication for anterior head weights. If I see forward head posture, I know I want to use head weights in the patient. It's just going to really determine on how much and for how long. Occiput extension is an indicator for anterior head weights, and C1 extension as well. These three things are our number one things that we're looking for when we look for anterior head weights. So these three x-rays really depict all the things I would look for when I want to do an anterior head weight on a patient. So how do we do this? So first of all, we're going to discuss kind of the home care process, and then we'll talk about how we do it in the clinic. So first of all is getting the fitting correctly. Anterior head weights need to be fit, like shoes need to be fit. If you're wearing the wrong shoe, it doesn't feel too good. Well, if you're not wearing the right head weight, it doesn't feel too good. And in fact, it has very little effect in actually changing the spine long term. So here you can see a patient just with the head harness on, kind of just standing there with her, you're standing there in her neutral posture. And you're actually going to see a video of this, actually how we fit her, coming up real soon. But I want to kind of go over each picture. So what we did, first of all, is we stuck a 1 pound weight on her. And you see we stick a 1 pound weight on her, and her posture improves a tad bit. You can see she pulls back some, but not really to the extent I want her to pull back. So to me, this is too light. This is not really doing what I want it to do. So what I do is I keep increasing weight a half pound at a time until I get where I want to. So here, I'm going to show you later on where we stuck a heavier weight on her, and you can see here how she's looking up, she's extending. To me, this is too heavy. We do not want to have this weight on because this is not reducing forward head posture and not reducing occiput and C1 extension. In fact, if anything, it may be creating some occiput and C1 extension. So to me, this is too heavy. When I stuck a 2-pound weight on her, she actually reacted perfectly. She didn't extend, but she pulled back a little further than that 1-pound weight did. So this is absolutely perfect. I know if this patient wears this weight with our proper spinal adjustments and exercises that we perform, I know I'm going to get a really good post film in 12 to 24 visits. And of course, we're going to stress this to make sure it's actually doing what we want it to do. So how do we do this? Remember, the indication specifically is to reduce forward head posture. That's the first thing I want to see change. Second thing I want to see change is occiput extension, then C1 extension, then I want to see the lordosis last. The first three are far more important before I see an approval of a lordosis in a stress film. Instructions. I do not instruct the patient how to carry the weight. They reactively carry the weight based upon how they carry it. I stick the weight on them. I just tell them to look straight ahead, and I watch what their head does. If you have to instruct a patient to tuck their chin and look back, well, now it becomes an isometric. It's no longer a reactive exercise. Repetitions. Patients start off with 2 minutes or so, and then they increase their time 30 minutes to a minute a day till they get to roughly 10 minutes. And we want them doing this twice per day at home. Now, can patients do it more than that? Yes. If somebody has extremely weak neck flexors or want to get faster change, they can do this up to 4 to 6 times per day at 10-minute increments. Yes, I'm actually saying that correct. Somebody can do an hour of head weights a day to actually get faster changes in their spine. Because remember, the head weights are what's helping support your adjustment and allow them to heal in a new position after you adjust them. Remember, the special thing here is that you got to make sure you follow the proper fitting, and they got to make sure they wear the head weights appropriately. So a goal of a stress film, once you have the head weight fitted, you want to take a stress film. A stress film means that you take a lateral cervical with them wearing their weight. And the number one thing you want to see reduce is forward head posture. Not necessarily a curve come back into their neck. A lot of times, if a patient's extending, doing something we don't want them to do, where they're extending to carry the weight, their curve is going to look really good. However, they're going to be extending or decreasing the interspace between occiput and C1, and that means the patient's just an extension, so it looks like you're getting a good film, but the reality is you're not. You want to see an increase of C0, C1, and C2 interspace. If those two goals are met, reduce forward head posture and increasing C0, C1, C2 interspace, I know one thing is happening. The patient is tucking their chin, pulling back, strengthening their neck flexors, and I'm going to see a better film after a period of time. Third and last thing I want to see is the lordosis improve. The lordosis necessarily does not have to improve on a stress film for it to be indicated. In fact, some cases they may actually get worse. And if it gets worse, but the first two things get better, I'm still okay with that. A lot of times you're going to see reversals come in. You may see kind of the so-called buckling of the spine. If the first two things happen, I'm happy with it. A lot of times when somebody has an extreme extension of C0, C1, and C2, when they pull their head back, what you're truly seeing is the reversal of their spine if they weren't an extension to begin with. So understand that we're looking for the first two things first. And last thing, I can't say this enough, don't be fooled by a good-looking lordosis without checking to make sure the first two goals are occurring. Extremely important. Again, I said this like 6 times, and I'll continue to say it. Do not be fooled by an extension film. If a patient is extending their head to carry the weight, more than likely you're not going to have a good post film. So let me kind of show you this one more time. So the first thing is when we fit the person is that here it's kind of a drawing. You see the patient's wearing the 2-pound head weight. Now I typically start with 2 pounds, because that's the most common weight that we tend to use. However, sometimes we can start lighter or heavier depending on what I think is going to be with the patient. What I'm looking for is the weight to pull down. You can see the arrows, kind of the green arrows pulling down, and then the body's going to react backwards. And you see when the weight pulls down right here, the body should react backwards. The eyes should stay horizontal, and we want to see a reduction in forward head posture. This is a correct reaction. This is exactly what we want to see. However, If the weight is too light, what's going to happen is nothing is going to happen. If that's the case, I want to continue adding weight 1/2 pound at a time. Now, why did I switch our weight system from carrying only 1 pound increments to 1/2 pound increments? Because I believe you can skip somebody. 2 to 3 pounds is a lot of weight. So if you go from 2 to 3, and 1 they don't move and 3 they extend, that means they're 2.5. In fact, if you remember, our first weighting system, the application was every third of a pound, which I believe was way more accurate. However, it was taking very long to fit people, and sometimes it was very hard to make a decision. So a 1/2 pound is a pretty good compromise. I've been very successful in getting very good fittings with 1/2 pounds. If somebody extends just slightly, we just go down, have them wear that weight for a little while, then increase into a half pound after a week or two as their neck flexors get stronger and they do neck flexion exercise. Now, if they extend, this by far is way worse. I would rather have somebody have no motion than extending. No motion means at least you're not driving the occiput and atlas into further extension, which is the number one subluxation that patients tend to have. So if you're driving them into further extension, the first thing you want to do is decrease weight, a 1/2 pound at a time, until they pull back into this normal reaction. Normally you can find a sweet spot between when there's no motion to between when there's extending head. Now you may find a pound difference. Like here they're at 2 pounds, here they're at 4 pounds, where at 3 pounds they're going to be perfectly centered. Or here they may be at 1 pound, at 2 pounds they may not be motioning, at 3 pounds they may be extending, but at 2.5 they're looking good. It's that sensitive. You cannot take this fitting lightly. It's extremely important to get correctly if you want to make sure to get a good pre and post x-ray. So here it is in writing for you. You start off with 2 pounds. You wait for the reaction. A lot of times if the person marches in place, you can elicit a reaction a little faster. It takes about 20 seconds or so for the body to start reacting. What you're looking for is the head to pull back over the shoulders without extending. If that happens, great. You go on to step 5, which will be taking a stress film. If not, if they don't move, you add weight a 1/2 pound at a time until you see a reaction. If you get to 4 full pounds with no reaction, that means they're too subluxated. That means you've got to try again after 2 weeks of care or so. More likely they're too rigid. You need to take some pressure off that nerve system, get their spine more flexible, and go forward. However, if I get to 4 pounds, I will still take a stress film with them wearing 4 pounds. Now let's say you put on that 2 pounds initially and they extend. Well, what you do is you decrease weight a 1/2 pound until they don't extend anymore. And once they don't extend, you go to step 5, which is take a stress film. Now if you get to just the weight of the harness and they're still extending, which the weight of a harness is about 1/4 pound or so, that means their neck muscles are so weak they can't even carry that. That means you need to prescribe cervical flexion exercise and try again after a week or two till their neck flexors get a little stronger. Now the good thing about neck flexors is they actually respond pretty quickly. If the person does the exercise 10 times, 3 to 4 times a day, you'll get a recruitment within a week or two. And then of course the last thing you want to do is after 2 to 5 minutes, now here I have written 5 minutes, but anywhere between 2 or 5 minutes you want to take a lateral cervical with a head weight on. Don't have them wear this thing for 15 minutes the first time and take a stress film, because if you do that, they're going to fatigue, and if they fatigue, you will not be able to take a proper stress film, because if they fatigue, more likely they're going to start extending. So 2 to 5 minutes is the most I'll go. I don't like even going to 5 minutes the first time to wear a head weight. I like to go about 2. Now let's say you put the head weight on there and they can't, your X-ray machine is full and you can't take them back. Have them take the weight off, have them rest for 10 or 15 minutes, then redo the stress film after a period of time. Don't have them sit there and wait with the head weight on while you're waiting for the X-ray room to open up. So go ahead and watch this video on me actually fitting that patient live, and once you're done watching that video, we'll come right back. Hello, this is Dr. Tony Nalda here. I'm going to talk to you about how we actually do the head weight fitting in the clinic. So in our clinic, we actually have several harnesses here set up with different poundages already put together. And we have a harness here on a patient. And the idea is that you want to fit the weight for the person. We have these in 1 pound increments. However, I recommend you have them every 1/2 pound.
when you actually do a fitting. The reason why is because you're going to find that every half pound is the appropriate jumping. But for this video, we're going to just do it every pound to make it simple. So we're going to start with a 1 pound head weight. So this is 1 pound head weight. The patient has their harness on, and the idea is that you're going to put this on, and you're going to kind of see their reaction. To stimulate a reaction, you're going to have the patient march in place very softly like that. And what you're looking for here is the patient's head, to see if they actually move. You can see she has not moved. Her head is still in a kind of a forward head posture position. So you know this weight's too light. Now, for some reason, if you put this weight on and she went extended, look up, if she went up like that to carry the weight, to make it easier for her to carry because it was too heavy for her neck, so she extends, that means the weight's too heavy. That means you need to go down weight. For her, she did no motion. So we take this thing, we'll take it off. And then you go to your next weight. So this one is a 1 pound. I'm sorry, this is a 2 pound. We start off with a 1 pound. This is a 2 pound weight. We're gonna put this one on the front of her head, like this. And then she's gonna kind of carry this and see what happens. Right? And you can see here she's pulling back a little bit. You can actually see her head go back. So this is getting closer to her weight. Right? And if she pulls back appropriately the way I would like it, I would stick with this weight. If she doesn't, I would add more weight. If she extends like this, then you know between 1 and 2, it's too heavy. That means she's more likely a 1.5 pound weight. But here she kind of holds still. She kind of moves back a little bit. So let's see how she does with 3 pounds. So we'll take this weight off. We'll try a 3 pound weight. So this one here is 3 pounds. We'll put this one on, and this, get it under nice and tight, and then she'll kind of walk. She's still not extending. She's pulling back a little bit more. So 3 pounds is looking pretty good. I mean, I'm kind of liking 3 pounds. This is closer. So I'll be happy with this fitting. I'll take this one off. She didn't extend, so I know it's still not too heavy. Now this one, this 4 pound one, I imagine she'll probably extend on it because I think it's going to be too heavy for her. So go there and see when she carries it. So you see how instantaneously she starts lifting the head to pull back. So this is now she's extending for me. This is too heavy. I don't want to be using this weight. Okay. So the rule of thumb is if you put a weight on and they extend back like this, it's too heavy, you need to go down. If you put a weight on and they stay forward and they don't move, it's too light, you need to add a little bit of weight. Now what if you get all the way to 4 pounds and she still doesn't move, her head's still out here forward? Well, what that means is that her head, she's too subluxated. Her spine has too much subluxation. You need to adjust her for a couple weeks and then do a refitting in about 2 weeks after care to see if the spine will respond afterwards. What if you put in 1 pound and her head still goes back? And then you can go to the actual harness. You can take all the weight off and just use a half pound. So your head still goes back. You use just a harness. And let's say her head still goes back. What that means is that her neck flexors are too weak. So it means that she needs to do neck flexion exercise for 2 weeks. And then you try putting a half pound on after 2 weeks of that to see if she gains the strength here in her neck flexors. Okay, so that's the general rule of thumb on how you actually fit a head weight. But this is how we do it in the clinic to make it efficient, is that we have several harnesses set up this way so we can actually do a fitting relatively quickly. When you find the weight you want, you have her wear it for 2 to 5 minutes, then you take her back and you take an x-ray to see the response during your day 2 stress x-ray.
So I hope you enjoyed that video how I fit that patient. Now, unpacking your head weights and putting them on is something that's important too. So I've created a little video actually how you can unpack the head weights and put the weights in the appropriate pocket. Now, if we want to keep the weight as centered as possible, so I like to keep the weight as close to the nose as possible. Now, if you space 2 pounds evenly across their forehead, what I find is you don't get as strong as reaction as if you place 2 pounds directly in the center or over those 2 center pockets as opposed to evenly spread out. So I like to pack the weight in the center as much as possible. So go ahead and watch this video about how we unpack the head weights, and I'll be back in a few seconds.
Hello, this is Dr. Tony Nolly here. I'm here to talk to you about the head weight package that you received from your doctor. When you get your head weight, it comes in the box of this, and you unpackage it, open it up, and the package comes with a couple of different pieces inside. As you take it out of the cellophane, what you're going to find inside of here is going to be the actual harness that carries the head weight and then an actual strap. The strap has a little bit of padding here now for your forehead. So I'm going to go ahead and unvelcro this so you can kind of see what we have. And then when you open this up, you're going to have head weights in here. You're actually going to have weights. Each bar itself is a half pound. It's a half pound bar. Most patients will be prescribed 2 to 4 pounds up here. So I'm just going to set it up for a normal 2 pound setup. So you're going to take these out. and that's going to be your typical 2-pound setup. Now, however, sometimes you're going to have 2 pounds in the center, so you can actually double these things up by putting 2 weights in one pocket. That's totally appropriate too. Your doctor will set up your configuration for you in terms of how he wants you taking it. So I'm just going to kind of set up for this normal version here, like that, and then you're Velcro this down. And when it's Velcro down, it's very secure. The weights don't fall out. It's nice in place. What you don't want to do is share your configuration with somebody else. You don't want to have, like, you wearing a 2 pound and somebody else wears a 4 pound and you're sharing somebody's other configuration. That's not recommended because it's going to be prescribed just for you. The way the head harness works, this is the part that attaches to your head, has a couple different adjustments that you can do to it for comfort. Is that this thing will come around the back and kind of goes through this loop and locks in. And then it creates this kind of headband. And then you have these 2 other straps. This one will come across this way and Velcro through this loop, just like that. And then this one will come from the front and come around this way and Velcro through here. So it creates like a little hat and it'll go on top of your head like this. This is to create a little bit of resistance so the weight doesn't drop down over your face. And then you make this as tight as you possibly can when you put your weight on. And I'll show you a little bit more when we actually set this on the patient. Okay, but that's your configuration. This is all the pieces that you should be getting. If you have extra weight, like I know the weights come standardly with 3 pounds, but if you only need a 1 pound or a 2 pound, just hold on to those bars because you may need them in the future. But follow the configuration that the doctor prescribed for you.
So I hope you enjoyed that video and exactly how we fit and unpack the head weights. Now, I created a video that's going to be on your website for patients to properly wear their head weights. So I want you to go ahead and watch this video and how we instruct patients to wear the head weights. The key thing here is the band is as close to their eyebrows as possible, the weight is centered, and they follow your prescription correctly.
Hello, this is Dr. Tony Nalda. I'm going to show you how to actually put your head weight on. So after you have your head weight configured and unpackaged and all the weights placed appropriately, your next step is actually wear the head weight. So your configuration should be roughly like this. You're going to have these 2 straps crossed this way, and the front of the band actually has padding. This is the part you're going to put in the front. So what you're going to do is you're going to unbuckle this, and the idea is you want to get this band as close to your eyebrows as possible. So you see how kind of close it's to the eyebrows. What you do not want to have is it sitting up like this. Okay, that would be inappropriate. So you want to have it real low, just like that, and go ahead and hold that in place. And then the idea is that you want to get this as tight as we can possibly get it to support the weight. So you can see that's kind of nice and secure. And then you can adjust these straps up here on top to kind of be secure in your head. This one seems to be pretty well. And then you want to get your harness afterwards. After this piece is already put on, then you want to get the actual part that carries the weight, and you want to place it on. And you want to have it perfectly centered right over your nose. Okay, and just like that. And that would be a proper configuration for the head weight. What you don't want to have, I'm going to unbuckle this a little bit. Okay, what you don't want to have is kind of covering your eyes where it's like this, or you don't want to have it off centered, like, you know, where it's kind of going up or over here in this configuration. You want to try to have it as centered. I'm sorry, I kind of grabbed this. You want to have it as centered as possible, okay? Also, a mistake that can happen with this is that you use somebody else's weighting system. Make sure that the weights are set up properly. I also do not recommend that you have this ready Velcroed on and try to put the harness on with the weight attached to this. It's 2 pieces to make it go on better, okay? So it goes on very precisely. Very tight to the eyebrows, very precise to the forehead, and then you put this on. If you have this attached while you're putting it on, it's very hard to get tight and set up correctly. That's why we kind of designed this one this way. So that's how you put your head harness on. And the way you would wear this, most cases, is going to work your way up. You're going to start off with 2 or 3 minutes and build up your resistance with this for 10 to 15 minutes. You can even go up to 20. I normally don't recommend you go much past 20, but of course, follow your doctor's prescription in terms of how often you should be doing this. But the most common, like I said, is about 10 minutes, twice a day, every single day.
Now, wearing head weights in the office is extremely important. So I like to wear head weights directly after their adjustment. And I like to get the head weights on as soon as possible. So the indication is the exact same thing as the indication for home care. The big thing here is that you only do it for 5 to 10 minutes after the adjustment. Normally about 5 minutes if you have a vibe plate. The vibration plate accelerates or it increases the muscle recruitment while they're wearing the head weight. You will get a better reaction with a vibration plate. But if you don't have one, they can just kind of march in place. What you don't want to do is, a lot of people kind of do head weights on a wobble chair while they're wobbling. I don't recommend that because they can't get a full benefit of the wobble chair. And then I've also seen people do head weights standing on a wobble disc. I don't recommend that either. The wobble disc is primarily used to actually recruit the torso to pelvis, not the head to shoulders. What you're going to find is that if you're wearing a head weight on a disc, you're going to actually get a less of a reaction. You want to try to get the head weight on as fast as possible. The research that Dr. Pettibon did with head weighting, that he got the head weight within 120 seconds or 2 minutes of the adjustment, noticed a greater effectiveness on the pre and post outcome compared to people who didn't do that. So getting the head weights on as quickly as possible is more effective. Remember, they have to reactively wear the head weight. You cannot instruct them to carry the weight properly. Now, one big thing is that a lot of people text when they wear a head weight. They can't be looking down. They can't be looking around. They have to be looking out into the horizon. Now, if they're looking at a TV that's at eye height or so, that tends to be fine. Some people sit in a chair working on a computer wearing their head weights. They can do that as long as the computer monitor is at the height of their eyes. But if they have to look down to type and all that kind of stuff, they're negating a lot of the effect the head weight's having. The best thing is they take their appropriate time, they stand and they look straight ahead out into the horizon wearing their head weight. Now, some people can say they can walk around the block wearing a head weight. You can totally do that as well. In fact, in my clinic, I have sometimes patients walk around my building wearing their head weight because they can't stand a vibration plate because they're contraindicated. As long as they're looking straight out, it's totally fine. Walking actually helps improve the reaction, so I don't discourage that. I actually encourage that. Repetition, you don't want them to go too fast, too long. You want them to start off with 2 to 5 minutes and increase their time slowly per day. If somebody goes 10 minutes, more likely they're going to start extending and fatiguing. You don't want them to do that. Start off with a very slow period of time and have them increase it as they continue and get stronger with the head weights. Remember, make sure you follow the proper fitting. I hope you enjoyed this video on how to fit the anterior head weights. It's extremely important to make sure we get the right correction. Now, one thing I will tell you is that in this level 1 protocol or the home care certification, all we discuss is anterior head weights. But when you move on to level 2, we have body weighting systems for the entire spine. And you can see we have a kit developed for that to actually get very good correction, just like we do in the cervical spine. And it has a very powerful effect, just like anterior head weights have a powerful effect in helping reduce cervical subluxation and restore that cervical lordosis.